The use of bisecting angle technique is necessary in dental radiography because we can only use parallel technique for the caudal mandibular teeth. But by using this technique, we can still obtain a true image of a tooth's length and width. Using this technique, we try to place the aiming cylinder perpendicular to the imaginary line that bisects the angle between the root of the tooth that needs imaging and the sensor plate. The easiest way for me to explain this to you is to have you think about your shadow and how it changes depending on what time of day it is. For this example, let's say that the sun in the sky is the dental machine. The person becomes the tooth, and the ground is the sensor plate. Then that makes the shadow that is cast equal to the image that will be on the sensor plate. When you achieve the perfect angle, the shadow that is cast will be exactly the same height and width of the actual person. When the angle is too high, the shadow becomes smaller. When the angle is too low, the shadow becomes longer. This is an example of elongation. However, when the angle is correct, the sun's light is projected perpendicular to the bisecting angle formed between the person and the ground, making the shadow that is cast an exact copy of the person. Similarly, when radiographing a tooth, when the angle is correct, an exact image of the tooth is obtained. For imaging the maxillary incisors, the sensor plate is inserted into the mouth so that the incisors are resting on the edge of the short side of the sensor. You want the sensor to be as parallel to the table as possible. The plane of the sensor is here. The plane of the incisors is this plane. Therefore, the bisecting angle is in this plane. The aiming cylinder is then brought in perpendicular to the bisecting angle. This is an example of the type of image that this technique would produce. This is the image that you just saw for the incisor view. Notice that the roots of the canine teeth are superimposed. Therefore, we need to do a tube shift to obtain images of the roots of the canine teeth. The sensor needs to be moved further back into the mouth so not to miss the apex of the root. The aiming cylinder is brought in perpendicular to the bisecting angle. There is only a slight difference in the angle between the setup for the incisors and the setup for the canines. Then the aiming cylinder is shifted 30 degrees to the right or 30 degrees to the left, depending on which view you are taking. This often results in cone cutting. This is an example of the type of image that this technique would produce. For imaging the fourth premolar and molars, the sensor is placed in the mouth in this plane. The plane of the tooth roots is this plane, making this the bisecting angle. The aiming cylinder is brought perpendicular to the bisecting angle. Now, to image the distal root of the fourth premolar and the neighboring teeth, center the beam between the fourth premolar and the first molar. This is an example of the type of image that this technique would produce. Obtaining diagnostic views of triple-rooted teeth can be a challenge. The tube shift or oblique technique is used to separate the superimposed roots of triple-rooted teeth. We are going to set up just as we did before. Then shift the aiming cylinder 10 to 20 degrees cranially or 10 to 20 degrees caudally to separate the roots. This is an example of the type of image that this technique would produce. Notice that you can see the apex of both roots. This view is set up much like the view for maxillary incisors, only now our patient is in dorsal recumbency. Once again, the sensor is placed inside the mouth with the incisor teeth on the edge of the short side of the sensor. The sensor is in this plane. The plane of the tooth roots is this plane, making this the bisecting angle. The aiming cylinder is brought perpendicular to the bisecting angle. This is an example of the type of image that this technique would produce. To image the longer roots of the canine teeth, the sensor needs to be shifted caudally. Determine the angles and align the aiming cylinder perpendicular to the bisecting angle. This is an example of the type of image that this technique would produce. The mandibular synthesis prevents use of parallel technique for the rostral premolars. Therefore, once again, the sensor is placed inside the mouth with the premolar crowns just at the long edge of the sensor. The plane of the sensor is this plane. The plane of the tooth roots is this plane. Therefore, this is the bisecting angle plane. The aiming cylinder is positioned perpendicular to the bisecting angle and the view is taken. This is an example of the type of image that this technique would produce.